Welcome to the Nurtured Parent Podcast, a judgment-free space educating and empowering parents like you to nurture yourselves and your young ones in a way that works for you. I'm your host, Kim Hibbard. Just a quick disclaimer at the start of this episode, Nurture is a show for entertainment purposes. Neither myself or the producers of this show are licensed professionals, and none of the content on this show should be taken as formal advice. Kirby joins us today with over 10 years' experience as a family and sports chiropractor. Kirby has many and varied special interests, including sports chiropractic, applied kinesiology, optimal maternal positioning, and chiropractic neurodevelopmental pediatrics. And it is the latter two areas that we're going to explore today. As a national and international CrossFit athlete and an Olympic weightlifting champion, Dr. Kirby has first-hand experience of how vital it is to give the body ongoing care and treatment to perform at a peak level. Whether you're a professional or amateur sports person or a pregnant mum, like both Kirby and I, Kirby's dedicated to ensuring her patients reach their goals through chiropractic care and applied functional movement techniques. Dr. Kirby's devotion to working with pregnant mums and children is where her expertise shines brightly. We are honoured to have her share her knowledge with her extra 2-year postgraduate diploma of chiropractic neurodevelopment pediatrics. Dr. Kirby is a joint force of both strength and knowledge, and she brings a holistic approach to health and vitality. As I said, Kirby and I both sit here pregnant today, close to our due dates, so we're hearing her professional knowledge, but also likely her first-hand experience as she's navigated her pregnancy. We couldn't be more honoured. Thank you for joining us today in your last week prior to maternity leave, Kirby.
You're welcome. It's my pleasure.
So you've studied for years and years and practiced for over 10 years, and you're now growing a human, and you are a professional athlete. So please share with us how you nurture yourself every day, week or month.
Well, I was an athlete. I'm certainly no level of athlete now, although growing a human is like doing a marathon every day, I swear to God. So I guess the way that I nurture myself has changed over the last couple of years. When I was doing a lot of CrossFit and weightlifting, it looked a lot different to what it does now. My life was very different back then too, when I was single and everything. And now I'm not only growing a human, but I'm a stepmom of 2 kids as well, have a husband, 2 dogs, busy house, very different. So I guess first and foremost, I eat really well. I've always eaten quite well, especially since starting CrossFit more than 10 years ago. CrossFit kind of went hand in hand with the paleo diet back then, and I'm by no means strict paleo or anything like that anymore, but I've dabbled in every diet you could think of, I've done over the years. But these days I just eat really well. I eat to nurture my body. I eat foods from nature. And I really prioritize that for our household here as well. I still exercise. It just looks obviously very different at 9 months pregnant than it did previously. So now I still do Pilates, some yoga. I do walk my dogs every day. So we do definitely get some sort of exercise in every day. I get adjusted. Obviously, I'm a chiropractor. It's one of the perks is I've got many friends that are chiropractors that can adjust me. I get regular massages. I sleep, not so much now, but I do normally prioritize a lot of sleep. It's just uncomfortable at the moment. They're probably my top ones. They're very basic, but, you know, that's the reality of life is it doesn't have to be complicated.
Yes, I couldn't agree more. Sleep is such a priority, and eating well and all those things go hand in hand. They are so simple, but sometimes simple is best, right?
Yes.
For those
absolutely.
of us who don't have a great understanding of chiropractic practices in general, can you explain your modality to us?
Yes, I will explain it in simple terms as I can. Chiropractic is a lot more than snapping backs and cracking necks, as most people probably picture it from TikTok or Instagram or YouTube. It's actually based around the nervous system. And so a lot of people don't realize that we're actually more so nerve doctors than we are spine doctors. But it's based around making sure that the body can talk and communicate to the brain, and the brain can communicate back to the body. So if there's any sort of interference in those messages going in and out of the brain, it can change the way that the body acts. And so essentially, if there's any stress on particularly the spine, we're most interested in the spine, and that's because all the nerves come out at every segment of the spine that control the body. If there's any change in the movement of that part of the spine, then it will change the information going into the brain. And the brain will recognize that in a different way. And so it'll change the information coming out of the brain. So that information coming out of the brain might go to a muscle. And let's say, for example, that muscle may now test weak, or that muscle might be too tight, which is why people experience pain and things like that, and injuries. That information could be going to an organ system, so that could change the way that that organ functions, and that's, where we kind of link in headaches and neck pain and those sorts of things as well. Or it could be going to, the coordination of all muscles. So in kids in particular, we might see, a change in their movement patterns or their coordination or things like that. So yeah, it's more about making sure every segment of the spine, but also we can adjust, shoulders, elbows, any joint in the body, essentially we can adjust. It's just making sure that everything moves properly, so that not only you feel really great, but also all those nerves and that information coming in and out of the brain works appropriately as well. Was that too complicated?
No, I thought because yes, as a child I saw a chiropractor, and my mum is a chiropractor advocate, and I thought I understood it, but that is quite simple, but makes a lot of sense in so much more detail than what I probably appreciated as a child. So thank you. So to layer onto that, how would you describe your maternal and pediatric care services?
Well, very different to a standard, let's say, athlete. So the way I might assess and adjust an athlete is that really classic kind of chiropractic way. We measure range of motion and we do muscle testing and all of these sorts of things to see how the body is functioning. And the way I adjust an athlete is, again, that traditional chiropractic way where we use what we call manual adjustments, and that's that classic cracking that you see on TikTok. But we also might use other modalities as well. We have adjusting tools such as it's called an activator, which is like a little clicker that some people might be familiar with. Some people have what we call drop piece tables, where the table moves up and down at the same time. So there's many different ways, again, that I can adjust an athlete. But when I'm working particularly with a child or a baby, let's say, for example, we completely change our techniques again. So babies are obviously very different to adults. They have a very different spine. Their spine is not fully formed yet. It's actually mainly cartilaginous at that point, so it really doesn't require much movement at all. And so I guess the analogy I often use for the amount of force I would use on a baby would be as much as you could kind of handle on your eyeball or checking to see if an avocado was ripe. That is literally as intense as it gets. So it's more about, I don't want to say baby massage because it's not a great description, but if you kind of envision that, that's more so what it looks like. It's very gentle, especially with babies and kids. I don't personally manually adjust babies and kids. I don't know many chiropractors that do. Back in old school chiropractic, they may have taught that, but certainly these days it's not taught that way at all. So yeah, I guess that's the kind of difference.
Yeah, absolutely. And what are some of the benefits that I could perhaps, or you have received from being a pregnant mum using chiropractic care?
Well, again, with pregnant mums, obviously the way I adjust and assess is kind of like a combination of both. Certainly around that pelvis and around that baby, we're very gentle, and around the rest of the spine, we can adjust as appropriately. But if I often use the examples to mum, if you think about the pelvis and it's kind of like a a round structure. We've got the front of the pelvis at the front where the pubic bone sits, and then we've got what we call the sacrum at the back where the sacrum sits, or that tailbone area. So it makes a bit of a diamond shape when you look at it from above. And I don't know about you, but I would like to push a baby out of a big diamond, not a small twisted diamond, essentially. So we want to make sure that that pelvis is sitting where it needs to be, and all the ligaments and all the muscles that support that pelvis are at the same tension on both sides. Otherwise, we are really restricting that ability of the baby to come out. So we want to make sure also while the baby is growing that there's no super restriction on that baby as well. So sometimes babies often come out with misshapen heads and things like that, and that could be simply from the actual birth, or that can be from in utero, that baby being really restricted in there because there's not enough movement and not enough room in there. So obviously we want the baby comfortable, but also we want the mum comfortable. One of the big things that women often come in with is like sciatica and pelvic pain and lower back pain when they're pregnant, and that's because obviously there's a lot more pressure on that part of the pelvis, and if that is already not functioning very well, then generally that leads to more pain. So we really want to make sure that all of that pelvis moves really well, and then so we can ensure that the birth goes as smoothly as possible. And then after birth, I often see pregnant mums for what I call breastfeeding body, which is the opposite. It's usually upper back and neck pain from carrying a baby or feeding a baby and those sorts of things as well. So particularly for me throughout my pregnancy, I'm, touch wood, very lucky I haven't had much back pain, sacral pain, and I put that down to two things: getting adjusted regularly, but also really keeping up with my exercise and Pilates and things like that has really allowed those structures to stay nice and strong throughout pregnancy as well.
Yeah, absolutely. That speaks volumes. I'm sure it's not a coincidence that you're not feeling pain, as much as some women might. So, yeah, I too try to walk every day and practice yoga, and I can feel the difference as I slow down or if I don't do it for a week. So, yes. So talk us through why we may bring our little ones to see you and what benefits they may gain from having chiropractic care.
So I guess I'll start at the very start. So if we're talking about babies or infants, one of the reasons parents may bring their child to see me, and particularly a baby, might be they're quite an unsettled baby. They classically are really refluxy or colicky or something like that. The parents might have noticed that they might have a bit of a misshapen head. That's another big indicator that something's going on. And so essentially a baby can't speak to you obviously and say, "Hey mum, my neck hurts, can you help me?" But they will scream and they will give you a few little indications. So one of those things might be that you notice your baby always sleeps facing the left side and they never sleep facing the right side, and because of that they're developing a really flat spot on the back of their head on that left side as well. They may also have trouble feeding off one breast compared to the other breast, and that's because they've lost that full rotation through their neck as well. So they're the kind of little indicators we see along the way that perhaps maybe there might be some dysfunction in their neck that's not allowing them to turn to both ways. And so probably the biggest reason a lot of babies might come into our practice. For older kids, it can be anything from, it might be a sporting injury. These days, kids are actually coming in complaining of neck pain and back pain because they're all on iPads and, TVs and switches and all of these things. So, patients often joke to me, I'll never be out of a job with the generation coming through. And it's so true. I see people in my waiting room with their heads down on their phones, before and after adjustments, and I just kind of think, oh my God, we didn't have that as a kid. I've never complained, I don't remember, of neck pain or anything like that as a kid, but I see a lot of kids also that or on the autism spectrum, or might have ADHD or behavioural issues as well. Often these kids have a lot of sensory dysfunctions and things like that as well. So a lot of the care I do with kids is not only the adjustments themselves, but a lot of home care exercises and things like that as well. So if they've got dysregulation in how they, let's say, for example, how they want to move their body all the time, let's say, for example. So if we can find lots of things to fill that void, then generally your child will be calmer. So often I send kids home with a lot of homework, whether that's specific like marching exercises or something like that for coordination, or it might be as simple as that kid can't sit still. So, hey, let's buy a Fitball and let's buy a wobble board and let's buy some fidget toys at home. And then that way they're kind of filling that void and they can calm and regulate their bodies as well. So it's not just about for me in particular, it's not just about adjusting the child, it's actually looking at the child as a whole and what else can we do to kind of fill in, to really regulate this child a lot more physically, but also emotionally and mentally and those sorts of things as well.
Yeah. And all of, yes, the iPads and the iPhones and things are creating more issues, but running a nanny agency for many years, it was very obvious to me that parents do have children with more diagnosed needs. So I think, having an outlet or a modality such as chiropractic care that can support that is so important also. Because by nature they have support from nannies and babysitters. So yeah, that's wonderful to see that it's also in other avenues. What are some of the myths surrounding chiropractic care? You sort of touched on that. Back in the day, certain practices or beliefs were held. What are some of the myths that you can bust, that maybe the top 3 that you can think of that parents might be thinking that just aren't true?
I would say that chiropractic care for kids is unsafe. Again, social media hasn't been kind to us. The media hasn't been kind to us over the years, especially when it comes to chiropractic and babies. Like I said, years and years ago, they may have taught chiropractors to adjust kids differently. From now, we understand that a child's body is very different. They don't need a lot of force to get some changes in the body. So, in fact, in 2019, Safer Care Victoria did a review into chiropractic care and us seeing kids under the age of 2. And that came about after a social media post from a chiropractor that kind of went viral and it didn't look great. So this was ordered by the Health Minister of Victoria at the time. And so they asked the public to and practitioners to give their information, I guess, of their experiences and all of these sorts of things. And there was, I think, around 20,000 responses from parents. And of those, 99% of parents said that they had a great experience with the chiropractor in their child, so 99%. And then 98% also said that they saw an improvement in their child's well-being after seeing a chiropractor as well. So they're pretty good statistics from parents. And again, they were just the random general public. And from that, the biggest thing was also that there was 0 reported cases of harm to children or any really severe negative side effects. And that's purely because, again, like I mentioned, the techniques that chiropractors use are very gentle and they're modified for the appropriate age of the person. Just like if I saw a 90-year-old, I would modify the way I adjusted them compared to a 25-year-old athlete. We look at the person as a whole and modify our techniques. So that's probably the biggest myth of how safe it is. So that review actually ended up being really good for chiropractic in the end, that was ordered. So originally they actually wanted us not to be able to see kids under the age of 2. So that was not the case, which would have been hugely sad because we really make a big difference to those kids in those first 2 years of life. So any other myths? I don't know. They're probably the biggest ones. And then I'm going to, again, when I see a parent, for example, and I'm thinking of bringing my newborn in, you don't snap their neck, do you? And I'm like, no, I don't hang them upside down. I don't crack their necks. It's nothing like that. So that's probably the other big one for a lot of parents. They want to know that we're not going to hurt their child in any way.
Yeah, absolutely. Okay, so why do you love what you do? It's so clear, Kirby, that you're passionate, you're knowledgeable. Why do you love it so much?
I think I just touched on it in that, especially when I see kids, it's the difference that you can make in a child from the simplest of things at the start can make the biggest change later on. So, for example, I mentioned before babies that have that flat spot on the back of their head. Now, most parents aesthetically don't want their baby to have a weird shaped head, and that's a reasonable reason to bring your child in. But that condition, which we actually call plagiocephaly or plagiocephaly, it can be linked to developmental delay. So had that child just come in right at the start and we were able to get their head turning from side to side, then we can prevent all of that happening later on. And again, that child may then be delayed in walking or talking or anything like that. So I think that's the reason I get up and do what I do, is that I know what I do every day makes a difference in people's lives. But even just for the general adult or general population that are coming to see us that have a sore neck or a sore back or a headache or something like that, I don't know, I've got a good job. I get to help people feel better. So every patient is different. It's never boring. It's always exciting. And I'm blessed I chose a job that I actually get to help people every day. So, yeah, that's why I love what I do.
That's awesome. And just days out from starting your maternity leave, what are your top tips for pregnant women listening today with regards to thriving in pregnancy? I know we've sort of touched on some throughout the podcast already. So what would you say you would share as your advice for pregnant women if they are listening, if they are pregnant and listening?
Get lots of rest. Outsource as much as you can. I'm certainly not one person that likes asking for help a lot, and I know that's something I'll have to learn to do more and more when I have a newborn baby. But asking for help when it's needed, taking rest as much as possible, looking after your body as much as possible, like I mentioned at the start, eating, sleeping, all of those sorts of things. Get adjusted, I guess I could say that. Go see a chiropractor, or at least some level of body work person, whether it's a massage therapist, an osteopath, someone that's going to help your body thrive throughout pregnancy as well. So yeah.
Wonderful. We're so grateful for you taking the time to join us on the Nurtured Parent podcast right before you celebrate the birth of your bubs. We wish you all the best with everything. And for our listeners who would like to know more about you and your chiropractic team in Geelong, where should they head?
Our website is geelongchiroclinic.com.au, or like most people, you can find us on Instagram, Facebook, TikTok, and we're just simply Geelong Chiropractic on those resources. So, yeah, we post lots of funny reels and things like that. We actually, our main modality at my work is sports chiropractic. So we have a number of myotherapists, exercise physiologists, nutritionists, things like that work at my work as well. So it's not just chiropractic, it's a big multidiscipline practice. I'm the kind of in the little niche of pregnancy and kids, but a lot of our practice actually thrives around that kind of sports chiropractic side too. So, yeah.
Yep, wonderful. Well, all our listeners, I'm sure, will check it all out and see everything that they have to offer. So thanks, Kirby, so much.